Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911.
Well, hey everybody, how you doing? I hope you had a great weekend. Hopefully you had a great holiday too. Don't you love Labor Day? Gives everyone that works a 4-day weekend. I know I always loved it. So far I'm doing okay with my right leg. No issues, no problems. We've got the next surgery coming up, I believe, in 2 weeks. So we'll get that one done and hopefully I'll have my strength back. I feel like my right leg is doing better. It has been giving me strength, or the strength is coming back to it, and I really haven't had no pain or aches in that leg. So we'll see how it goes after I get the next surgery done. But you know what? Today we're going to be talking about 2 different supplements. We're going to talk about flaxseed oil, which is one I take, and also fish oil. I've taken that in the past. But I'll tell you why my reasons are later here in regards to why I like flaxseed oil better. But the reason why I want to bring this up is because there's been some new studies that have come out in regards to fish oil supplements. And some of the claims that they're making that they had made in the past, with that supplement. So I'm going to go over that new study. But first we're going to talk about what is flaxseed oil and what is fish oil. Also, I'm going to talk about black seed oil. I don't know if any of you heard of that before or have used it. I've never heard of it, but we're going to talk about that for just a little bit also. So for as long as this episode is going to be, we'll get into it right now. So when it comes to flaxseed oil, of course, it is a good source of essential omega-3 fatty acid. So the acid in flaxseed and other chemicals in flaxseed is seen to decrease swelling, which is why some people use it for conditions that involve inflammation, such as rheumatoid arthritis. Flaxseed oil is used for heart disease, high blood pressure, high levels of cholesterol or other fats, which are like lipids in the blood, and many other conditions, but there is no good scientific evidence to support these uses. Flaxseed oil has different effects than whole or ground flaxseed. So here's some new things I didn't know. Possibly ineffective for bipolar disorder. Taking flaxseed oil by mouth doesn't seem to improve symptoms of mania or depression in children with bipolar disorder. High levels of cholesterol or other fats in the blood. Taking flaxseed oil by mouth doesn't seem to reduce cholesterol. Taking flaxseed oil by mouth doesn't seem to reduce body weight, body mass index, or weight size in overweight adults. And rheumatoid arthritis, taking flaxseed oil by mouth daily doesn't seem to improve symptoms of pain and stiffness in people with RA. There is interest in using flaxseed oil for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. So here's some side effects taking flaxseed oil. When taken by mouth, flaxseed oil is likely safe for most adults. Supplements containing 2 grams of flaxseed oil daily have been used safely for up to 6 months. Higher doses of the up to 24 grams daily have also been used safely for up to 7 weeks. These larger doses can cause side effects such as loose stools and diarrhea. Allergic reactions are also possible. Now, I'm trying to think why they say only 6 months or 7 weeks, because I've been taking it, for since 2014, I think, since I found out about it. And, I'm going to be taking it for the rest of my life. If it does anything or helps, I don't know, but it hasn't hurt me any, so I'm going to keep taking it. So when applied to skin, flaxseed oil is possibly safe when used short term. Flaxseed oil has been used safely on the wrist for up to 4 weeks. So now when it's applied into the eye, whoa, flaxseed oil is possibly safe when applied into the eye short term. Eye drops containing flaxseed oil have been used safely for up to 3 months. Redness and itching may occur in some people. That's weird. I don't know about putting that in my eye. Here's some special precautions and warnings for people that are pregnant and breastfeeding. Flaxseed oil is possibly safe when taken by mouth in doses of up to 2 grams daily for up to 6 weeks during pregnancy. But using flaxseed oil during the second and third trimester has been linked with an increased risk of giving birth prematurely. Breastfeeding. There isn't enough reliable information to know if flaxseed oil is safe to use when breastfeeding. Stay on the safe side and avoid it. Alright, let's talk about your children. Flaxseed oil is possibly safe for children when taken by mouth short term. Flaxseed oil has been safely taken by mouth for up to 3 months by children about 7 to 8 years old. And finally, surgery. Flaxseed oil might increase the risk of bleeding during and after surgery. Stop using it at least 2 weeks before a scheduled surgery. So let's talk about interactions. Medications that slow blood clotting interact with flaxseed oil. Flaxseed oil might slow blood clotting. Taking flaxseed oil along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Here's medications for high blood pressure. Flaxseed oil might lower blood pressure. Taking flaxseed oil along with medications that lower blood pressure might cause blood pressure to go too low. Monitor your blood pressure closely. And the dosing is flaxseed oil has most often been used by adults in dosing of 1 to 2 grams by mouth daily for up to 6 months. If you plan on making any changes, make sure you talk to your healthcare provider to find out what dose might be best for you and your specific condition. Alright then, let's just go ahead and jump right into fish oil now, which also has omega-3 fatty acids. Now for myself, I've taken them once in a while here and there, but I just don't like the aftertaste of the anchovies that you keep burping up, so I went with flaxseed oil. But this one works just as good, but I want to talk about it because there has been some new studies done on fish oil that might change how you feel about taking it. Fish oil is the fat or oil that's extracted from fish tissue. It usually comes from only fish such as herring, tuna, anchovies, and mackerel. However, it's also sometimes produced from the livers of other fish, as is the case with cod liver oil. The WHO, which is the World Health Organization, recommends eating 1 to 2 portions of fish per week. This is because the omega-3 fatty acids in fish provide many health benefits, including protection against a number of diseases. However, if you don't eat 1 to 2 servings of fish per week, fish oil supplement can help you keep and get enough omega-3s. Around 30% of fish oil is made up of omega-3s, while the remaining 70% is made up of other fats. What's more, fish oil usually contains some vitamin A and B. It's also important to get enough omega-3s because the Western diet has replaced a lot of omega-3s with other fats, such as omega-6s. This distorted ratio of fat acids may contribute to numerous diseases. Heart disease is the leading cause of death worldwide. Studies show that people who eat a lot of fish have much lower rates of heart disease. Multiple risk factors for heart disease appear to be reduced by the consumption of fish or fish oil. The benefits of fish oil or heart health include improved cholesterol levels, decreased triglycerides, reduced blood pressure, and plaque prevention. Although fish oil supplements can improve many of the risk factors for heart disease, there is no clear evidence that they can prevent heart attacks or strokes. Number 2, it may help treat certain mental health conditions. And we're still talking about fish oil. Your brain is made up of nearly 60% fat, and much of this fat is omega-3 fatty acids. Therefore, omega-3s are essential for typical brain function. In fact, some studies suggest that people with certain mental health conditions have lower omega-3 blood levels. Now, while I'm talking about fish oil, I want you to remember some of the studies that I'm talking about now, and then I'll talk about the new findings that they found. Research suggests that fatty omega-3s can prevent the onset and or improve the symptoms of some mental health conditions. For example, it can reduce the chances of psychotic disorders in those who are at risk. In addition, supplementing with fish oil in high doses may reduce some symptoms of both schizophrenia and bipolar disorder. Though there is a lack of consistent data available, more study is needed to be found in this area. And fish oil supplements can improve the symptoms of certain mental health conditions. This effect may be the result of increasing omega-3 acid intake. So let's discuss where omega-3 fatty acids help with eye support. Like your brain, your eyes rely on omega-3 fats. Evidence shows that people who don't get enough omega-3s have a greater risk of eye diseases. However, this positive effect was not found for dry eye disorder in particular. Furthermore, eye health begins to decline in old age. Eating fish is linked to reduced risk of AMD, but the results from fish oil supplements are less convincing, and AMD is age-related degeneration. One older study found that consuming a high dose of fish oil for 19 weeks improves vision in people with AMD. However, this was a very small study. Two larger studies in 2013 examined the combined effect of omega-3s and other nutrients on AMD. One study showed a positive effect, while the other found no effect. Therefore, the results are unclear. Inflammation is your immune system's way of fighting infection and treating injuries. However, chronic inflammation is associated with health conditions such as obesity, diabetes, depression, and heart disease. Reducing inflammation can help treat symptoms of these diseases. Because fish oil has anti-inflammatory properties, it may help treat conditions involving chronic inflammation. For example, increased weight or stress can sometimes contribute to high levels of inflammation. In two older studies, one in people with obesity and one in people experiencing stress, fish oil was found to reduce the production of gene expression of the inflammatory molecules. Moreover, fish oil supplements can significantly reduce joint pain, stiffness, and medication needs in people with rheumatoid arthritis, which causes pain in the joints. While inflammatory bowel disease is also triggered by inflammation, there is no clear evidence to suggest that fish oil improves its symptoms. Your skin is the largest organ in your body, and it contains a lot of omega-3 fatty acids. Skin health can decline throughout your life, especially during old age or after too much sun exposure. With that said, fish oil supplements may be beneficial in a number of skin disorders. Your liver processes most of the fat in your body and can play a role in weight gain. Liver disease is increasingly common, particularly fatty liver disease, in which fat accumulates in your liver. Fish oil supplements can improve liver function and inflammation, which may reduce symptoms and the amount of fat in your liver. Depression is expected to become the second largest cause of illness by 2030. Interestingly, older studies have shown that people with major depression appear to have lower blood levels of omega-3s. However, the results have been inconsistent so far. As you age, your brain function slows down and your risk of Alzheimer's diseases increases. People who eat more fish tend to experience a slower decline in brain function in old age. However, studies on fish oil supplements in older adults haven't provided clear evidence that they can slow the decline of brain function. Nevertheless, some very small studies have shown that fish oil may improve memory in healthy older adults. Asthma, which causes swelling in the lungs and shortness of breath, is becoming much more common in infants. A number of studies show that fish oil may reduce asthma symptoms, especially in early life. However, all the studies have found similar results. In an older review in nearly 100,000 people, a mother's fish or omega-3 intake was found to reduce the risk of asthma in children by 24 to 29%. Furthermore, fish oil supplements in pregnant people may reduce the risk of allergies in infants. So, for me, I had 3 of my kids had asthma and bronchitis all the time, and they had the croup. And if everyone knows and has kids, they know what the croup is. So, I just wanted to bring that up. I meant we didn't give them any fish oils back then, but I just wanted to let you know that, that is an obvious question that needs to be asked if that does help or not. But remember, with any changes to your regimen or starting taking or stopping, make sure you talk to your doctor first. There could be cautions or precautions that you need to watch out for that it could affect you. I know most people are allergic to fish. I am. And, that's why fish oil wasn't a very good combination for me. So talk to your doctor first and ask him about it. During old age, bones can begin to lose their essential minerals, becoming more likely to break. This can lead to conditions such as osteoporosis and osteoarthritis. Calcium and vitamin D are very important for bone health, but some studies suggest that omega-3 fatty acids can also be beneficial. People with higher omega-3 intakes and blood levels may have better bone mineral density. However, it's unclear whether fish oil supplements improve BMD. In one study, researchers found that omega-3 supplements increased BMD in women with no symptoms or bone pain, but it did not appear to do so in women with osteoporosis. More research is needed. So the BMD I'm talking about is the bone mineral density. So the bottom line in regards to fish oil, omega-3s contribute to typical brain and eye development. They fight inflammation and may help prevent heart disease and a decline in brain function. Because fish oil contains a lot of omega-3s, people who are at risk of these health conditions can benefit from taking it. However, eating whole foods is almost always better than taking supplements. And eating 2 portions of oily fish per week can provide you with enough omega-3s. That said, fish oil supplements are a good alternative if you don't like fish. Now that I'm reading this right here, I'm probably going to also post a video from this one doctor that I like very much. And because everything that he talks about, you can tell he's not trying to sugarcoat anything. He's giving you the truth, and he never makes promises, and that's one thing I like about him. But I'll post that because he talks about some fish that isn't really good for someone with diabetes to be eating. So yeah, I'll bring that video and make sure you guys have that. Okay, so now we're going to talk about most fish oil supplements make unsupported heart health claims, finds a new study. And here's why experts say most people can skip them. For years, fish oil supplements were promoted as an important way to boost health and particularly heart health. But recent research has shown mixed results on their impact. Despite some supplement companies continuing to promote their products as having a big influence on health, still nearly 10% of U.S. adults take fish oil supplements. Now, a new study finds that many fish oil companies make claims that are untested, and that a wide variety of amounts of omega-3 fatty acids, the core healthy fats in fish oils, are in their supplements. So this is what the study says. The study finds that a majority of fish oil supplements on the market make health claims that aren't backed up by clinical trial. For this study, some of the key findings were researchers analyzed the labels of more than 2,800 fish oil supplements and found that 2,082, or nearly 74%, made at least one health claim. Of those, only 399 used a qualified health label that was approved by the Food and Drug Administration. But nearly 81% of those supplements made claims about the structure or function of what supplements could do, such as saying that they promote heart health, with cardiovascular claims being the most common. The researchers also noted in the study's conclusion that most fish oil supplements labeled make health claims that imply a health benefit across a variety of significant diversity and quality in the daily dose of EPA and DHA in supplements, leading to potential variability in safety between them. So this is what experts think. It's worth noting that supplements are a largely unregulated industry in the U.S. companies. These U.S. companies can put new supplements on the market with the FDA approval. They're just expected to adhere to the FDA guidelines about safety and labeling. The agency also monitors reports of adverse events after products are up for sale. This is an important reminder that supplements are not FDA regulated and may not truly know what is inside the bottle. So with this study, why do so many people continue to take fish oil? Many people take fish oil because of long-standing beliefs about its potential health benefits, particularly for heart health. The supplement industry, anecdotal evidence, and earlier studies have often promoted these benefits. Once a narrative becomes deeply embedded in popular culture, it can be difficult to change, even when new evidence emerges. So real quick to finish this up, there is potential harm in taking fish oil supplements, this one doctor says. They may have additives and fillers, and we don't know what they are. Fish oil can also raise the risk of bleeding and fibrillation, he says. I tell my patients that large placebo-controlled trials have failed to show any benefit for prevention of heart attacks and strokes. So if they are taking it to try to lower the risk of those, they can't stop. They are far more effective pills to lower the risk of heart attack and stroke. And fish oil supplements aren't usually covered by insurance, so they can get expensive. And then finally, supplement labels. This is the same doctor. Supplement labels can be confusing even for the most savvy of consumers. Patients should talk to their doctor about what supplements they are taking and why they are taking them. They may be surprised to learn that they are not getting the health benefits they think they are. And there you go. So that was the new study that had just recently come out. So I hope you got some information there on supplements, those two, flaxseed and fish oil. I'm sorry I can't get to the black seed oil. Maybe I can do that later in some other episodes down the line. But again, thank you for being here. I'm going to post a video plus all this research material I found for you, and so you can look it over yourself or take it to the doctor. For me, I'm going to continue taking my flaxseed oil. If it helps, it doesn't, but I feel it does for myself. And that may be a placebo effect, I don't know. Thanks for being here. And don't forget, check out my merchandise store for Neuropathy Support Group. I'm running a sale, 10% off plus free shipping. And that's for Labor Day. So, all of you, I hope this Monday is great for you. You have some fun, get out there and enjoy the weather. And go have fun with your family. Be safe. And I will talk to you next Monday. Bye.
As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode plus others are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.